Dr. Chant, it's been over a week now since we opened up. Case numbers are still sitting in the 200s. Are you still expecting them to go up, and at what point do you think that would happen? In the next few days or early next week?
Look, there's a lot of uncertainties about what case numbers will do. We would believe that they would go up. As we have more interactions, they'll go up. But as I said, it is in the hands of everyone. So the more people continue to get tested, the more people follow the public health advice, the more people that get vaccinated all give us protections. So we have, to some extent, all of the modelling depends on judging what the testing levels are, what the vaccination levels are, what the number of interactions people have. So we've given guidance, and so to some extent it is about how people behave responsibly as we open up, what the models will show. But we are expecting, it does take a lag, so we wouldn't be expecting numbers to rise within a 2 week, 2 week period. We'll get a sense. So next week I'll be really interested in what our numbers are. But we are working very hard to keep the numbers as suppressed, and I'm so pleased we've got 90,000 tests. We're going to need to keep those testing rates up, and thank you every one of those individuals who've come forward.
Are there any areas that you're watching closely, just in terms of case numbers in certain areas? Are there any areas that are causing you concern that you're watching closely?
Obviously we're working closely with our Victorian colleagues around border communities. We're obviously very focused on our Aboriginal communities and making sure that we're suppressing whilst vaccine coverage gets up higher in those areas. And it's a big call out because we do know in some of our regions there is just slightly lower vaccine coverage. They're catching up really quickly, but we want to buy them as much time to get those levels up as high as possible. And as I've said before, I want to get 95% or even above, because it still leaves a lot of people vulnerable, and we will also see COVID transmitting. This vaccine will not create no COVID. What we need to do is still keep levels suppressed so we're less likely to impact on a vulnerable person. But our narrative will also change, where we'll be much more asking people to make individual decisions about what they do. So it'll be about guidance for immunocompromised, guidance about what's a safer environment to eat outdoors. We'll give tailored messages for people that have got those particular risks, because notwithstanding the great effectiveness of the vaccines, there will be, if you're very elderly or you've got severe underlying health conditions, even if you're fully vaccinated, it's not the vaccine, your likelihood if you come in contact with COVID will still be a greater chance of hospitalisation.
Just to be clear, the Aboriginal rate of vaccination is still lagging behind the rest
Our Aboriginal vaccination has really gone up radically, and I'd just like to thank all the hard work of the Aboriginal community controlled, our local health districts, our primary health networks, GPs, pharmacists, everyone has, and the Commonwealth, everyone who has played a role in pushing that up. All I'm highlighting is that for me, I want to really see those levels as high as possible. We know they have been a little lower, and there's been that disparity, and what we're doing now is putting intense effort to catch it up. And I just want to again acknowledge the role of the Aboriginal community controlled in reaching out to the communities to get those vaccination coverage up as well.